99.7 FM. Joy 99.7 FM. Joy 99.7 FM.
Okay, back to proper programming. Many thanks Ziggy for extending the Ghana flavor to cover for our technical hitch.
Joy 99.7 FM.
Ultimate Health on Joy 99.7 FM. In line with our Ghana flavor, we're taking a look at additional tales and treatments when it comes to any races. Bedwetting. I'll hold my breath and let you share your traditional indigenous names. Bedwetting. I read somewhere that if a child breathes an electricity pole or breathes the grinding stone used to grind pepper, it may be a cure.
Joy 99.7 FM.
What were you told? Is it that you were lazy, stubborn, unlike your siblings? Did you know that up to 50% of persons who bedwet have parents who bedwet? Let's tell the truth.
Joy 99.7 FM. Joy 99.7 FM.
So today I'm in the studio with Dr. Beatrice Nyan, consultant pediatric nephrologist at the University of Ghana Medical Center. You've heard pediatric, you've heard nephrology, so you know why she's here. She's here to confess that she bedwets. Next to her, I have Dr. Nobishi Akutu, clinical lead, consultant orthodontist. You know her because she brings her dragon, and she's in the dental field. From Platinum Orthodontics and Advanced Dentistry at Airport Hills. You'll be wondering, what has she got to do with bedwetting other than a confession?
Joy 99.7 FM.
Let me not waste any more time. Ladies, you're welcome, and it's International Women's Day, so it's not by accident. Happy Women's Day to both of you.
Thank you very much.
And apologies for this terrible pickup, which caused me to be later than late. I can't explain it on the air. But yes, any races. Beatrice, you're a pediatrician. For many people, it is difficult to accept that this could be part of normal development. Now, let me put myself in a child's mode. I have Hotmail. I need to download. Who cares where, when, or how? So is urinary continence, the control of my bladder, is it normal? Is it expected? Or did we create it as human beings?
Anyway, so good afternoon, and good afternoon to your cherished listeners. I haven't been here in a while.
I know.
But I'm happy to be here today. And you know, interestingly, it also happens to be Kidney Month.
Yeah.
So typically we celebrate the World Kidney Day on the 12th of March every year.
It's coming.
But now in Ghana, and especially with we the pediatricians, we have designated the month of March to be Kidney Awareness Month.
Okay, and it's also, is it World Oral?
Yeah, so there are lots of health days and health months.
So I couldn't have dodged the two of you.
It was excellent.
Okay.
So that's why we are here.
Okay.
Great. So I'm happy once again to be here. And bedwetting, as we are trying to move away from that term, I'll be using the term enuresis.
Okay.
Because, you know, as you know, bedwetting connotes or sends across, it's a bit derogatory, bedwetting. So we'll say enuresis. Okay, so even for the layman, it's allowed for a layperson to use the term enuresis, so that bedwetting is put to the background. So it's a very interesting topic, and it's one topic that I'm quite passionate about. So I do a lot of education on bedwetting.
Okay.
You asked the question, so is it something, urinary continence, is it something that we as human beings have created it, or we can do it anywhere, anyhow, anytime? Let me just walk you briefly through when babies are born. So it's actually a problem of maturation and development. So as we know, once you have a baby, the baby pees anytime, anywhere, under any circumstance. Some might not even cry when they pee. But the time...
Beatrice, let me just butt in. Are you a parent yourself?
Yes.
You see now. So not just pediatrician, but another P. She's a parent.
And I have the experience too.
Right.
I don't know whether she's listening. Now she's grown out of it.
Great. Go ahead.
So, and then it gets to a
Joy
point where
99.7
when the baby
FM.
pees, the baby might cry, be a bit uncomfortable lying in the pee. And as the baby grows, we do potty training. Some might delay a bit, and so on and so forth. So usually, any age before the age of 5 is allowed. You can pee.
You can download.
You can download anywhere,
Hot
anytime. But usually potty training will start 18 months, 2 years, and going on. But enuresis is actually involuntary wetting when you sleep. So after the age of 5, if a child sleeps and wets himself or herself, then it qualifies as enuresis. Okay. So prior to that, you can download anytime, anywhere, under whichever circumstances. You are allowed. It's allowable.
And nobody should be giving you grief.
Not at all.
I know this constitutes a phenomenon which is triggering anxiety for parents and children alike.
Yes.
And the children are listening. They are listening, right?
Yes.
So up to 5, I'm still within means. I'm still grappling with this thing. Yeah. And we also mark it as a developmental milestone. They say, when did you crawl? When did you walk? When did you learn
to be potty trained? Yes.
Potty training or
and
bladder
then,
control.
Exactly, bladder control.
Okay.
And then also even stretching, no wetting during sleep time.
Okay. Now, key things you said. Involuntary.
Involuntary, manshada.
It's not on purpose, not deliberate, not because I'm stubborn, not because I want to show mommy.
Yes. Okay. Deliberate. You are lazy.
Involuntary. Manshada.
Involuntary.
Right?
Yes.
Voiding.
Involuntarily when you
night.
Sleep. Yes.
Okay. We have nocturnal.
Yes.
Right? And some
we have
void during the day.
Exactly.
It is also of concern.
Yes.
Right? We'll get there.
Yes. Okay. We'll get to that.
Right. Now, I'll come to Dr. Akutu in a bit, but are some people born with the inability to acquire this? I know there's another division or separation we can look at. Yeah?
Yes, so that's an interesting question too. So
Joy,
as you said, you have involuntary voiding when you are asleep.
Right.
There are some people who can have involuntary voiding even when they are awake.
Okay.
That's a separate entity.
Okay.
And there are some people that it is a continuous voiding, so it's all the time.
They never acquire.
They can never
acquire
exactly
the control.
Okay. Those are also in a different category because they tend to be associated with real serious problems.
Right.
With the bladder, with the nervous system, the spine. And some have, unfortunately, it's audio, but some have, where the tube that connects the kidney to the bladder, the ureters. Some are inserted wrongly, so it's free flow all the time. Those are different, and usually those ones get a lot of sympathy even from their carers. So the ones that are the problem, I think that's where we want to focus on this afternoon, are the ones that have absolutely usually no problem, but it's a developmental problem.
Okay, you just joined us 30 minutes past your 2 already. Sorry for that. Ultimate Health on Joy 99.7 FM. We're talking about enuresis. Okay, I know I've been schooled, and I know on my flyer I did put enuresis, but I want you to be spot on with us for now. Okay, involuntary bedwetting, right? You don't do it on purpose. It's not a result of you being lazy, stubborn, unlike your siblings, and so on and so forth. You just heard speaking Dr. Beatrice Nyan. She's a consultant nephrologist with the University of Ghana Medical Center. Next to her, uncommonly for a topic like this, is Dr. Novishi Akutu, consultant orthodontics with Platinum Orthodontics and Advanced Dentistry. So this is the advance we've been dodging. Because to have you here, Dr. Novishi, why are you here? And is it again to do with some personal experience or confession?
Absolutely not. Well, first of all, thank you so much for having me back on here. And just as Beatrice was saying, it's also World Oral Health Day on the 20th of March. And we are really, really looking at how a happy mouth can lead to a happy life. So all various things that are associated with life. And actually, this is such an interesting topic. And part of the interest is that literally every orthodontist comes across some of these studies that you'd never ever think about. But a lot of studies are out there that have proven that actually fitting one of the appliances that we fit in the mouth can help significantly reduce enuresis. So I'm here to really explore that.
Wait. You know, I like to do this, and Ziggy likes to be in front of me when I'm looking at nice ladies. But you say that fitting an appliance, we haven't gotten into that yet, can significantly and empirically proven reduce enuresis. I know, and I've done some reading. Actually, I do teach a course in childhood developmental disorders, right? So I know some of these things. So does it mean that all cases are possibly, potentially treatable through this means you are going to tell us about?
So I think that by definition, you always start with things that are more common, and also things that are simpler and more readily available. So really, we are looking at a select caseload that have not responded to the more traditional
treatment resistant
enuresis. That we expect our pediatric colleagues to actually go through. And so by the time we are seeing this cohort, it's usually from a referral from a pediatric team where they have crossed off all the other etiological and finding factors.
Right. So then that brings in the magic you do. You mentioned, and I can see some of the things on the table, right? I can see sets of teeth. So you're saying essentially you can put something in a child's mouth, which is in your field of orthodontics, and that can yield significant beneficial results and reduction in wet nights.
Yes. So if we delve a little bit into the literature and what has been shown, and quite conclusively, and this is actually amazing because we all know that a lot of research, once you get to the higher level of evidence, always says there is insufficient current evidence. But this is the opposite. There is sufficient evidence to show that as much as 74.2%, so almost 75% of children with nocturnal enuresis who undergo this process actually do have a successful outcome of stopping the particular habit, in this case, enuresis.
You're hearing this on Joy
99.7 FM.
Said before me, but you know where you are, right? Ultimate Health with Nortey by nature, and yes, Ghana Month. What do you call it in your part of Ghana? Right? In Ghana, they say Shamolo. I'll leave the rest to you when you WhatsApp or when activate those phone lines. How were you treated? Did it sound like what I said in my intro, that it's your fault, it's deliberate, you are stubborn? Have you been restricted fluids, right, after a certain time of day? Fluid, so that at night you are likely to have a dry night. Have you had ginger and all those things put in your private parts to basically teach you a lesson? Some people say Christian training. right? That's what we're talking about. And we're hearing from diverse angles and perspectives how this can be addressed. Okay, you just heard Dr. Novishi Akutu from Platinum say that, look, in over 70% of cases that are like Willie, they are resistant to treatment, right? On the basis of the appropriate physical and other examinations and referral, her field's intervention can yield significant results. You've never heard me bring in a dentist when we're talking about enuresis. You're hearing it here on Joy 99.7 FM.
Joy
We'll go into the
99.7
details.
FM.
Yes, we've lost some time, but we'll go into the details and just looking at how comfortable they look and how they've announced their days and their months and the fact that it's International Women's Day. I know next week I'll have them. We will continue to talk about enuresis, not bedwetting. Okay, coming back to you before I swing back to Dr. Nyan and Beatrice, I'll be coming back to you to see, is this something you would typically refer to a dentist? Okay, I know there are ear, nose, and throat people and things and all that. So I'm going to put Novishi in the witness stand. Okay, so are you suggesting to us that there may be something wrong with my oral cavity or how it operates, and this may affect my ability to control or regulate my bladder movements?
So I think, or I know that when you look at what the research is saying, and I keep referring to research because I feel like we don't get in contact with our counterparts enough to be getting this level of referral.
Only on ultimate.
So when I have got involved in treating of these cases has been when I was at Birmingham Children's Hospital, where you have a whole hospital for children, and so these sorts of things are actively being picked up and monitored. But we start to look at, yes, the structures and what's actually going on. And this automatically starts to lead to airway. Are these particular children able to breathe enough? Is it something that's going on whilst they are actually sleeping, which is then having a trigger to a hormone that is allowing them to actually produce more urine?
Right.
So the moment we start to look at this from our angle as dentists, we start to look at airway, we start to look at sleep apnea, we start to look at what is the actual shape of the roof of their mouth. We find that the roof of their mouth, their palate is very, very steep instead of being flat. A lot of these children actually grind. The cardinal sign is that a lot of them, or almost all of them, do not breathe through their nose, which is what is deemed more appropriate. They actually breathe through their mouth. So
Parents, listen up. Parents, listen up. And I work with a lot of kindergartens and creches, right? And there are things you can pick up very early. So let's listen and be attentive, okay? Shortly, I will activate the phone lines. Continue, Doc.
So we are looking at things that happen together.
Joy
We are looking at mouth
99.7
breathing.
FM.
We are looking at grinding of teeth at night. We are looking at what they call postnasal drip. So they have a lot of tonsillitis. They have a lot of problems with their adenoids and breathing in general. You know, and we're also looking at behavioral patterns. A lot of this particular group are also labeled as having ADHD, attention deficit hyperactivity disorder. And what we find is that these things seem to be occurring together. And once we are looking at how much oxygen they are able to get in, and we are treating that, then almost as a side effect, it's being noted that, oh, actually, enuresis is actually going down or being totally and utterly eliminated in 3/4 of these same individuals.
Okay, great. Folks, I hope you heard that. Breaking it down, if you have irregular sleep, and you can have irregular sleep or sleep disorders based on your breathing patterns, whether they are interrupted or not, based on the structural things, how your oral cavity is shaped. She's mentioned the palate. I hope she will break that down. And so if you're not getting sufficient oxygen supply in sleep apnea, you stop breathing and struggle. Snoring is indicative. because now you are struggling to breathe and you hear the noise of the air passing the structures. Children who snore, you find a correlation. Okay, so that's what she's saying. So if they get in there with this select group that present this cluster of symptoms, then they're in business. That's what she's saying. She's not saying everybody who has enuresis. Doc.
Yep.
You're both doc, but I'm glad you
I responded.
You knew it was
reflexly.
you. But
Yes.
as a pediatric nephrologist,
Yep.
right, sitting next to her listening to this, and she's actually acknowledging that we are not cross-referring enough. We are not doing some of the work, even us the psychologists are in this business when we come to management. How does this come across?
Okay.
And then relate it to the general pool as well.
Yeah. So I would just elaborate a bit more on
Great
what
stuff.
she said, and just to light onto the major causes of enuresis. Then it will dovetail into what she said. So we know some will say spiritual, but we know that there are clear. Studies have shown that there are clear pathways by which a child or 3 children would wet even after 5 years when they sleep. So one, because of where she started from, I'll go through that that channel. So we will have what we call sleep disordered arousal or dysfunctional sleepers.
Yep.
So that's what dovetails into what she said. So that's one pathway. So studies have shown that, sleep studies have shown that children who wet when they sleep have a disordered arousal pattern.
You know why I'm watching
And
your
it
fingers?
stems...
I'm watching your fingers because, of course, we can plot this on a graph.
On a graph, you see.
Okay.
And it stems from some of the underlying causes that she mentioned.
Great.
One notorious one is the adenoid hypertrophy. So because they have sleep apnea, their sleep is quite disturbed. So the thermostats, God in his own wisdom has put in place a lot of mechanisms.
Amen.
So for children who have that struggle to sleep, when they fall asleep, it is difficult to arouse them.
The regulator
Exactly.
is not regulating.
It's not regulating well.
Right.
Because they've had apneas, they have adenoid hypertrophy, even their palate, she will probably throw more light on that. So the struggle to
size
sleep.
of the tonsils.
The tonsils. So once they sleep, it's difficult to arouse. And it's a cause of enuresis.
So therefore, it becomes a compromised arousal process. You already have something that is to wake you, arouse you, and then you respond.
But because
But that arousal is dysfunctional.
It's dysfunctional.
Thank you.
Because they are struggling to sleep. So when they sleep,
Joy,
it is difficult to arouse them.
99.7
So you have
FM.
parents telling you, look, this is my child. It is difficult to arouse this child.
Slow down. You see, as soon as you say it is difficult to arouse them, then I do have listeners who are young. They say, it is your job to wake me. And you, mommy and daddy, you have slept. Can we clarify? There's a regulatory system, okay? And it's supposed to, as the neurological system and many other structures mature, it's supposed to do this work by itself.
Yes.
Okay? Yes, we will train you, but it should do that. So can you clarify, because people are saying, Charlie, this is what we hate. We have to wake Mansa up or Jigbodi or me. Is it the parents' job?
Unfortunately.
And for how long is it their job?
Unfortunately, dealing with
Joy,
enuresis is a lot of
99.7
commitment
FM.
and teamwork.
Okay.
Multidisciplinary, multifaceted, even in the house. So unfortunately, I have to say that parents have a good role to play in the management of enuresis.
Okay.
So usually, once I am presented with a child who has enuresis, I start with their motivation level. So if I have a child who's probably around 7-6 years, I would typically just reassure them, ask them to go back and come after some time, because you need a very well-motivated child and a very well-motivated caregiver to help holistically manage enuresis. It is not one-sided.
So the child who is not well motivated, and the carer who is also
not well
throwing missiles like what they are doing elsewhere, right? You do not comfort that child.
Also,
you trigger their anxiety. Anxiety will lead to more.
So usually,
right.
So the thing to also, so usually we start with reassurance.
Thank you.
One, for them to know that by far almost there are a few exceptions.
It is not just you.
Exactly.
It is not just
It
you.
is not just
One of the
you.
myths is that it is just you.
No.
And you are trouble.
No, not at all. And
Okay.
almost everybody would usually grow out of it. That's one major hope I give parents when they come. That it is not limited to
Joy
your child.
99.7
Your child is not,
FM.
there are a lot of peers
You
around
sound
his
so
age who have
soothing.
it. And invariably he will grow out of it.
Okay.
But because usually enuresis can have dire psychological effects on some children, that is why we try and intervene.
Okay.
If you were to look at the natural history, a lot of people will grow out of
They
it.
grew out of it.
Will grow out of it. So you reassure them. We do some behavioral, takes here and there. But then if the child is quite close to the 5 years, as I keep telling you, a lot of papers will say that give them some time.
All right.
If you're peri 6-year-old, give them some time. Reassure them. A few behavioral, interventions here and there.
Okay.
But give them some time.
Okay, folks, Sunday, we're having fun, but we still get it done. It's called Ultimate Health, your ultimate guide to healthy living. Listen every Sunday, 2:05. We are live with all the issues. If it impacts your health and your well-being, we'll talk about it. We'll bring the professionals and the practitioners. We've got them in the studio. Yes, they look nicer than me, I know. Yeah, but for a reason. Okay, International Women's Day. Tomorrow they won't look nicer than me, right? But Dr. Novishi Akutu is a consultant orthodontist with Platinum Orthodontics and Advanced Dentistry, Airport Hills. They are no stranger to the program, and she's just explaining to us that hey, the things in that gated community you call a mouth, right? That oral cavity can impact on enuresis, can impact on your sleep, can therefore have a causal relationship, and therefore they as orthodontists can intervene in a specific way, and we'll talk about that hopefully before we rise. Dr. Beatrice Nyan is a pediatric nephrologist. Okay, I chose to skip it because I have discerning listeners, but just explain that.
Down
Yeah.
a bit. So a pediatrician is a doctor who takes care of the medical needs, takes care of children.
I'm getting, guess what?
Yes.
Dr. Beatrice Nyan is one of the best in Ghana. God bless you, ma.
Mercy.
Lydia Summer Hayes Dodu says, good afternoon, Nortey. I receive it though. Kindly send my greetings to Dr. Beatrice Nyan from the caucus of exotic women, and especially Candy Chocolate. My love to her. Candy,
My people.
the caucus of what? Exotic women. I want to join.
The doors are open.
All
for
right,
you
there's
to
other
join.
WhatsApp I must read, okay? But we're doing serious business here. So
yeah.
we are trying to understand. This reassurance is critical.
Yeah. Yes. And then we move on. But just to answer what you asked.
Yeah.
So typically we would work in connection with the ENT surgeons.
Aha.
So that's where we tend to do a lot of the referrals.
Okay.
But I think that, so moving on from there, they can actually also involve the orthodontics.
Okay.
To be, yes. But typically our first point of referral, once we have obstructive sleep
Okay.
apnea, is the ENT surgeon.
All right.
Yes.
I'll let Dr. Akutu explain some of what she'd be interested in doing.
Sure.
I know she's mentioned the palate. I know there's a soft and a hard palate, right? What exactly are you doing in the mouths of children? And does it apply? And is it only, should I say, effective with children? What if I'm 25, I'm 38?
So I think that's a really, really good question. And that's why we are bringing the awareness that the referral should also be to us. Because whilst we know that by adolescence, only 1 to 2% of people are going to be having enuresis,
Okay.
what happens with the airway can affect people in the long term.
Okay.
And forever. Because at that age, the whole skeletal framework is actually developing and growing.
Right.
And if there's an obstruction or there's something that is making you breathe differently, what tends to happen a lot of the time is that if you're breathing through your mouth, in order just to get sufficient oxygen and air in, what happens is that your tongue is made to go down so that the air can get towards the back of your throat. With the tongue going down, what then happens is that the hard roof of your mouth, and I'm going to use a model, the hard roof of your mouth, which has a bit of depth, but the depth is actually designed by where the tongue is.
Okay.
Once the tongue has moved down, the tongue is no longer pushing up and making it flat. So it becomes extremely steep, almost like a mountain.
Right.
And once you've got that, that affects the whole way that your jaw is going to grow. So what we find is that the bottom jaw, now that the tongue is lower down, continues to grow, but it continues to grow backwards. And these are things that are going to affect the individual for the rest of their life.
Okay.
You asked a really, really important question. Is there an age after which we cannot do much? And for us, what we are looking to do is to take this same hard palate that has become very steep, and we are trying to open it and make it flatter.
So we are expanding the palate.
We are expanding. And so this actual treatment is known as rapid. That means we do it quickly. We do it literally in 2 to 3 weeks.
Right.
Palatal, because that's what we call the roof of the mouth.
Okay.
And then expansion.
All right.
So we keep things really simple. Rapid, palatal, expansion.
Okay.
But the thing about age with this is that you have a zip line. Let's call it a zip right down the middle.
Okay.
It goes down the middle of the roof of your mouth and it comes between your 2 front teeth.
Okay.
And that zip gets fully closed around about the age of 15. So we like to do this sort of treatment between the ages of 7 and 15. Because after that the zip has closed, it's very, very difficult to then open the zip and allow the expansion
So you can
to
no
happen.
longer comfortably do that expansion
Very, very difficult.
with the should I say relatively short-term method you are talking about.
Exactly.
Okay. So what you're saying is that if you are able to expand, then this shape, which has been caused over time, now is more, should I say, open, and therefore a word doctor here used to use patent for breathing.
Yes, so it's amazing. So it really, really increases patency.
Right.
It really, really increases airflow.
Airflow.
Just this can actually change the whole, the actual whole direction of how the bottom jaw in itself is going to grow.
Okay.
We find that the sleep significantly improves with
Right.
sleep studies, etc. And even behavioral problems, tiredness at school, he's not concentrating, so and so starts to disappear because the individual is able to get a good solid sleep at night.
Awesome. 53 minutes, and it, unlike Nortey, I have not even announced phone lines because I'm so engrossed, right? I'm so engrossed, and I hope you are. 030-221-6541. Yes, we'll get to take a few calls. I'll read a few of the backlog of WhatsApp. They've changed my screen a bit. It says, blessed Sunday afternoon, Nortey by nature. This erases during sleep, I imagine, can be very embarrassing for adults who experience it themselves and also those whose children are experiencing it. My question is, at what age should one report this to the medical professionals for guidance? Prosper is asking this. I think we've suggested that already. Prosper, thanks so much. And please, I've had patients as old as, I think the oldest I've had was about 29. I've had people who don't do sleepovers because of this problem. I have people who could not choose boarding options for school because of this problem. Okay, so it's a big issue, and we will extend the discussion. Let me come back to you, Dr. Nyan. I want to quickly, because there's so many reasons and causes given, and it can also be an indication of bigger underlying problems for this child. I know some cases, it turns out it's constipation, right?
Good.
Pressure on the bladder
Yes.
because of something impacting the system in the lower intestinal tract and so on.
Yeah,
so can you
let me just
hit a
throw
few of
light
those?
on a few more. So I mentioned the first one. So one is that some people are born with small bladders.
Okay.
Where urine is stored.
Okay.
And it stands to reason that if I have a bigger pot to keep urine and you have a smaller one, yours will get filled early and you would want to void earlier than mine would. So small bladder capacities has been associated with enuresis or wetting.
Okay.
The other path is
But if I have a
that,
smaller bladder, shouldn't my regulatory system just be waking me up more quicker?
yes, so
earlier?
if you, yes, so it's, so there are pathways,
Okay.
but usually they work in combination.
All right.
There are some synergies.
So it's a
also.
related cause.
Exactly, it's a
Okay.
related cause.
Okay.
The other path is that usually at night there's a hormone that makes us keep more water so that we produce less urine, called
Okay.
the antidiuretic hormone.
ADH.
So God in his own wisdom again has made it such that at night we produce more of that hormone so that we make little or less urine. There are some children who have a dysfunctional pathway in this as well. So they tend to also produce more urine in the night
Okay.
rather than small urine.
Okay.
It's also another well-studied pathway.
Okay.
It's called nocturnal polyuria.
Okay.
There are some children who also have real problems with voiding. Voiding means passing urine.
Okay.
It looks like a very seamless process, but it doesn't come simple to a lot of children. So there are people that usually, if you want to pass urine, the bottle, the neck of that bottle that keeps the urine, the bladder, is supposed to relax the
Yep.
sphincter. Then the bladder muscles will pump the urine out.
Okay.
There's some that these two fight. As the relaxing part is supposed to relax, it's rather contracting.
You know what?
And it's called
we can go
dysfunctional
to
voiding.
court and defend.
Children who are
Different
wetting.
children.
Children who are wetting.
We put the
In
case and please, parents,
It is not
whether you are
a
whipping
problem
them, marching
at
them through the
all.
streets with their mattresses or whatever, I've got doctors in the studio that show you that, Charlie, it wasn't them at all.
Oh, I think maybe I shouldn't even, because I think I chanced upon one that a child was severely assaulted for passing urine. I said, no, I need to talk about this
Yeah.
for wetting. It is not
Yeah.
their fault. There are clear medical and
Abusive
physiological pathways where
So-called
children should-
interventions.
Yes.
Right.
There are some children who also have what we call
99.7
hyperactive
FM.
bladders.
Okay.
You know, you mentioned ADHD. It's also linked to that.
Okay.
Just like the child is hyperactive physically, their bladders are also very hyperactive.
Right.
So the small urine in there, the bladder wants to get it out.
Okay.
And those children also void. So typically, once we see a child who is wetting, wrongly in the wrong places at the wrong time, we go through all these in the history and see where the problem might be, and then we
Serious,
tackle it.
precise, accurate
We tackle it.
investigation assessment.
Exactly.
So the parent presents, and the whole case is enuresis.
Yes.
She wets.
Yes.
Okay. We haven't gotten to many of the things you will do to, right? But what you both suggesting to me is that a very detailed work
Very, very detailed.
assessment, examination, not just giving knocks and nicknames and in the house they call me waterproof or they call me Ko Macintosh or whatever. Huh?
Not
A
at
whole
all. It's a
serious,
whole
detailed-
typically, I can spend about an hour
Right.
in a consulting room on a child who is wetting. And I could have done 15 minutes with another
So my
condition.
1 hour here there is not enough.
Yeah.
We've
Is it-
got, we've got more
a
to
lot-
do.
yeah,
Right.
a lot of time.
Just a sec. Mr. Alfred, no, hey, my full name. I know this is Douglas from DC. Sunday with you is empty, not completed. Ichi. Happy International Women's Day to our guests. How many types of enuresis do we have? And does stress cause this? That's stress. Freud would say, traumatic toilet training. And he will nickname it so many other things and link it to sexuality and many other things. So Douglas is asking that. As a doctor, whether bedwetting is related to only females. So they're looking at the disparity, right? There's data which shows
it's more in males.
more in males, but then females start earlier and so on. Okay, this is Jane in Ofanko. Ask that. Does waking a child solve urinating in a gutter? Hey, wait. A child is urinating in a dream, in a gutter in a dream. Let me take my time and read this. Does waking a child up solve urinating in a gutter in a dream? So you are dreaming that you're in a gutter, okay, and then you find yourself in a pool. This is the dream, okay? How does waking solve that? That's what this person is asking, okay? We'll have to wrap up. But, Doc,
Yeah.
in fact,
Some of
docs,
those things, yeah.
right? We've hit 3 o'clock.
Oh.
Yeah, but we're still kind of wet.
Yeah.
Okay, but these are serious issues.
Yeah.
Dr. Nyan, I'll wrap up with you in this way. how prevalent is it? How big a problem is it? We are making it sound very, very big, but what's the stats?
So the stats vary because even in terms of definitions, it varies.
Okay.
But there's an International Children's Continent Society that try to standardize definitions so that we can have similar prevalences. So when we are looking at children who are between like 5 and 10 years, over 10%. Over 10%. Some even have it as high. I think in Australia they have very high figures. Some have about 75%. You can also throw in some of the statistics. So depending on the what you're using to define enuresis, some will say 1 per week. One, it doesn't matter. So the definition, but the standard definition is that between 5 and 10%, over 5 and 10 years, over 10% of children wet. The range is between like 5 to about 75%, depending on where you are coming from in the world. It is the most common chronic childhood condition. So let me just say that is like a blanket statement.
So
it's the most common chronic childhood condition.
Okay. So if you find Nortey by Nature doing 3 episodes on this, then we're not wrong, okay? We're not wrong at all, okay? Doc Akutu.
Yes.
I'm tempted to say, so what? Should we be marching to you, or should we follow what you've both said, which is that there should be a referral? Can I come to the dentist straight away and say, the thing you showed in the studio, put it in my son's mouth and be our plumber?
So I think
what
that
is your advice?
We definitely welcome in referrals, but if it's for the enuresis alone, what we will do is that we would obviously examine you. We will make sure that there isn't anything else going on, and then we would almost do what we call a back referral. We will say, okay, there are 2 categories. One of them, there's clear that there's something going on with the airway, with the let us treat that. But we are telling you that we are treating that because that needs treatment irrespective of the enuresis. If we feel that the treatment benefits for you in the long term, for what we can see orally, it's not that great, but you still have enuresis, we will back refer and say, go back to the pediatric team. Let them start with the simpler measures. And if you are resistant to those measures, which are usually simpler and quicker and faster, then they will work with us in conjunction and tell us when they want us to institute our modality of care.
Great stuff. We're wrapping up, and it doesn't look like we're wrapping up because even what you just said ushers us into more. But 3 minutes past your 3 Ultimate Health on Joy 99.7 FM. I'll thank my guest, Dr. Beatrice Nyan, consultant nephrologist, University of Ghana Medical Center. Thank you so much, Beatrice. I got you on short notice.
No worries.
Right.
My doors are always open.
Dr. Novishi Akutu, this is a revelation for many people. And I know my flyer caused a lot of consternation. Why is he bringing here again? Many people think I bring you here too many times, right? But this is the empirical evidence. We thank you so much. And can I tempt you guys to come next week? I'll be here at 9 a.m. or 10 p.m. Yes, I had a car problem which caused an issue.
Next week.
But we must do due diligence because there are many anxious parents out there, and there are many, should I say, comorbid conditions, related issues tied to this. Once again, thank you so much. To my producer, Ziggy, for playing so much Ghana music, and I was unable to give all the names and the, should I say, history about enuresis. Next week we'll be back. But I'll leave you with Papa Samo, who's sitting out there and doesn't want to come home. Stick and stay on Joy 99.7 FM. My name is Nortey by Nature. I'm out.